Hi there, it's Justin Lubino with Senior Advisors. Today's Wednesday, August 28th, 2019. And today I wanted to walk through a little sneak peek into the new Medicare Plan Finder tool that the government released yesterday, which was Tuesday, August 27th, 2019. So this is a very early on version of this new Plan Finder tool. We saw a demo of it initially about a week and a half ago, August 16th. CMS provided a demo of this new tool for us, and we had some concerns initially from the demo. And after playing with the tool for about a half a day, we continue to have some concerns, especially for this upcoming annual enrollment period. And we wanted to highlight some of those issues we're seeing with the new tool. This is a very important time of year. If you're on Medicare, we send out reminders to all of our clients to review their Part D drug plans, since this is really the one opportunity you have each year to change, to see if there's a more cost-effective Part D drug plan for you for the following year. Last year, we found about 50%, 50 to 60% of our clients, we found a more cost-effective Part D plan, saving in total over $2 million for our clients, just switching their drug coverage from the current plan they had in 2018 to a more cost-effective plan for 2019, which came out. So this is an important time. Normally we see more like 25% recommendations for savings and switching, and 75% keep their plan. And we're not sure yet for this year what it's going to look like, but it is a very important time, and again, it's the only time you can really change your drug plan. So the tool that exists out there today called Medicare Plan Finder, I'm going to walk through side by side with the new tool that was released just yesterday, and I'm going to highlight some of the concerns that we have initially with this new tool. And, again, this is only after 1 day of release, so, some of these things may be addressed in the next month or so, but the old tool is essentially being shut down at the end of September. So September 30th, 2019, the old tool will no longer be available, so we'll have to use the new tool for the upcoming annual enrollment period. So, like I said, I'm going to walk you through the differences. So this is the current tool that's out there today. This is the one we've been using for years, and it works actually very well. And then the other tab, when I flip back and forth, you'll see it has a different look and feel. This is going to be the new tool, again, that was released yesterday. So I'll walk you through the differences. And I'm not going to go through every flow. This is going to be a short. I just want to highlight some of the challenges or concerns that we have, especially considering we're just a few weeks away from annual enrollment here. Okay, so the first flow I'm going to take you through is really highlighting the main reason we use this tool, which is basically to find the most cost-effective drug plan for our clients. And the nice thing about the current tool is it figures out for us what the total overall cost is going to be, the premium plus the cost of the drugs for the entire year, for all 26 or 30 different drug plans that are out there based upon a specific list of medications. All right, so if we had to calculate that ourselves for all 26 plans, or 30 different Part D plans, however many there's going to be next year, we just wouldn't have the time to do that. We only have a 6-week period between October 15th and December 7th to go through all of this and enroll people in new plans. There just wouldn't be enough time to go through the thousands of reviews we have to get through if we had to do those calculations ourselves. So that's why this current tool that we have today, that we've been using for years, is so incredibly valuable, because it does all that calculation for us. So I'm going to walk through and show you an example. If we enter in a particular zip code, and I'm going to flip back and forth between the two tools so you can see what the differences are. So the first tool I just entered in a zip code. In the new tool, you can log in or do an anonymous search. So for the purposes of this example, we're going to look at the anonymous search so you can see them side by side with the existing tool. So this is, again, the new tool. After I put in, I don't want to log in, it asks me, do I want to learn more about options or view plans? I know what I want. For the sake of this example, view plans, I know what I want. A drug plan for Part D. And now they're asking me for my zip code. I'm going to put in the same zip code I just put in, and it populates the county for me. Now it's asking me for some more information. Do I have a Medicare number? So the old tool doesn't require me to answer these questions. It just lets me do the analysis and figure out the best drug plan. Here it's asking me for a Medicare number. I'm going to say no. What is your date of birth? Again, the old tool doesn't require us to enter in the date of birth. This is requiring the date of birth. Just for the sake of this example, I'm going to put a September birthday just to continue through the process. Do you get help from one of these programs? This is one of the questions that is asked in the existing tool as well. For now, I'm just going to say, I'm sorry, I don't get any extra help from these programs. And then you can click Next. On the old tool, the current tool that we use today, it's got similar questions. Where do you get your coverage? I don't get any extra help from Medicaid. And yes, I'd like to add my drugs. All right, so again, I'm flipping back and forth just so you can kind of get a feel of the difference in the flows. Continue to plan results. I go back to the new tool and hit Next. Okay, the new tool is asking us if we want to see drug costs when we compare plans. Yes, we want to see drug costs. That's why we're doing this analysis. How do you normally fill your prescriptions, retail or mail order? We're going to say both. All right, and hit Next. Okay, so now we're on the adding of the prescription drugs in the new tool, and then I'm going to do side by side with adding the drugs in the old tool or the existing tool so we can see the differences. For this individual, the medications that they're taking, I'm going to enter these in so you can see the autofill is going to populate. It's Synthroid is the first medication. It happens to be 200 milligrams, and it's once a month or 30, or once a day or 30 per month. So that's all correct. And then you click Add Drug and Dosage, and it offers me a generic option. This is the existing tool. And in this case, the person won't take the generic. They have to take the brand name. So we hit the brand name for Synthroid, and we click Continue. So we've just added that medication to the drug list for the existing tool. I'm going to go back to the new tool so you can see if we add in the same drug, Synthroid, it pre-populates the information just like it did on the existing tool. And when after we select the drug, we have to hit Add Drug. It gives us an option for generic. In this case, they only take the brand, so add brand instead. Now we have to add in the dosage. So it's a few extra clicks here. And they take the 200 every month. So then we click Add to my drug list. And now your drug list has that Synthroid in it. Now if I go back to the existing screen, now we're going to add a second medication. And in this case, it's called hydroxychloroquine. Okay, so that's the name of the next drug, and that's the dosage, and it's twice a day, so it's 60 per month, and we hit Add Drug and Dosage. So now the second medication has been added in the existing tool. In the new tool, we're going to hit Add More Drugs. We're going to start typing in hydroxychloroquine. It should start to show up. All right. We have to hit Add Drug again. And then the dosage, again, is 200 milligrams, and it's twice a day or 60 every month. And you click Add to my drug list. All right. Now we're going to add there's just 2 more drugs to add for this individual. We're going back to the old one, furosemide. And the dosage is 20 milligrams, and it's once a day. And then the last medication is clindamycin, and it's 300 milligrams, and it's about once a day, so that's fine. Add drug and dosage. Okay, so these are the 4 medications. I need to add the other 2 now to the new tool, so I'm going to add another drug here, furosemide. And the quantity is, let's see here, the dosage was 20 milligrams every month. Add to my drug list. We got to add another drug, and clindamycin. Okay. Add drug. Let's say 28 every month, and add to my drug list. So now we've got the 4 drugs in the new tool as well as in the old tool. They've been added. Now, one of the big differences with the old the old tool that's really nice is we have this drug list ID and password date and zip code. These three data points allow us to retrieve this list of drugs again in the future. So if we have to make a change to this drug list, or if we want to use it again in the following year, so we don't have to re-enter all the information, we have the ability to do that. We have a starting point to use for that drug list. In the new tool, that drug list is gone. This is a big change. So for all these reviews that we're doing, everything has to be re-entered again. If someone misses a medication on their list and they're reviewing the report, or they want to change a dosage, everything has to be completely re-entered. So this is a big issue. It's definitely going to prevent some efficiencies and the ability to do multiple reviews if people have any changes. So you definitely want to make sure you enter everything correctly the first time in the new tool, because you'll have to redo everything, if you have to enter it again. So that's one of the big issues or differences with the new tool that we've noticed so far. Okay, so we're going to proceed now, and the next screen is to select the pharmacies. This person goes to CVS and Liberty Pharmacy. We're going to get there on the old tool as well. So we're going to enter in the CVS and Liberty Pharmacy. And we're going to click Continue to Plan Results on the old tool. And on the new tool, we're hitting Done. Okay. So now the new tool this is the new tool. It has all the drug plans that are available. And I'll walk through this in a minute. On the old tool, we have one more click to check that we're looking for drug plans, because the new tool moved that question up to further in the front of the process. So now we're on the plan results page for both the new tool and the old tool. Okay, now the main reason that we use this tool, as I mentioned at the outset, and the most important reason, there's 26 different plans available right now for drug plans in this area. And this tool quickly calculates the total overall expense, that's the premium plus the cost of the drugs, for the entire rest of the year. So that's this number right here, the $322 in this example includes the $21.80 a month premium plus the cost of the drugs. It includes the deductible. If they happen to reach the donut hole and catastrophic coverage, it includes all of that in this one number. That's the most important number. We don't just look at premium. We don't just look at the drug cost. It's the combination of those numbers that determines what's going to be most cost effective for a particular individual. Okay, so, and then this automatically sorts the list for us based upon the lowest overall cost for the remainder of the year. In this case, the $322 for the Cigna plan is the lowest overall cost for the remainder of the year. And in this case, obviously, there's other things to look at like the star ratings, but from a cost perspective, this is the lowest overall cost. WellCare Value Script is next at $346. So you can see it has a lower premium, but that means that the drug cost must be a little bit higher. Because the total is a little bit higher with this plan. And if you keep scrolling through the list, you continue to see they go up. Each one goes up a little bit more than the last. But it does all that work for us. And that's why we use this tool, and that allows us to shop for the most cost-effective plans for our clients. So very important there. And that's another big difference with the new tool. In its current state, it doesn't calculate that total cost, which is that's the number one most important function of the existing Medicare Plan Finder, is figuring out that total overall cost, and it's not existent in this new tool. So this is obviously a big concern. If this isn't resolved before annual enrollment, we're probably not going to be able to find the most cost-effective plan. We won't have the time to go through all 26 of the drug plans to manually calculate the premium for 12 months plus the cost of the drugs, which is in the tool. That's what they do calculate, is the total drug cost. And they show you the monthly premium, but they don't calculate those together and allow you to sort by the lowest overall cost. You can only sort by the lowest premium, lowest drug cost, and lowest deductible, which doesn't get us the best plan. They're the most cost-effective plan. So in this example, you can see lowest monthly premium happens to be this WellCare plan. But the reality is the lowest total overall cost is showing up as the third lowest premium. And that's just coincidence. It happens to be that high in the list. It could be the 10th or the 15th. But this Cigna plan is the one that's the lowest overall cost. And there's no way for us quickly to identify that using the new tool, or even figure out what that total, quickly identify the total cost. We have to multiply the 2180 times 12 and add that to this 269, or really however many months are left in the year. You multiply the 2180 times 3 or 4 months. You add that to the 369, and that's how you get to the 322 total. So it's definitely concerning that information is not there. Hopefully this will be resolved by the end of September, before the old tool gets unplugged. But this is the only reason we really use the tool. And really, without this information, we won't be able to do a proper comparison, identify the most cost-effective plans for our Medicare clients. And frankly, a beneficiary out there doing it on their own is going to have a much more difficult time identifying the most cost-effective plan without that information. So that's definitely a big issue. We've got other issues in here as well. Some of the data is not correct right now with the new tool. That's probably just due to it's been out there for a day and they're still working through some of the kinks. But functionality-wise, the main issues I just mentioned, not calculating that total cost, not allowing us to sort the plans based upon that total expense, are the main issues. Not having that drug list ID, which allows us to quickly pull up a prior year's drug list and use that as a starting point, are all some of the major concerns we have with this year's annual enrollment period. So we wanted to bring those to your attention. There are one of the nice, and also the report. Let me just show you the report as well. One of the nice things we have, let's just show you with the old tool. If we want to compare the plans, the top two plans that show up here, and we want to look at the cost per each of the drugs at each of the pharmacies and what tiers they are, whether there's any restrictions or step therapy, all that's available in the existing tool. We can print a comparison report, which prints very nicely for us. We can set, what do we want showing up in this report, and I'll show you an example of what these reports look like compared to the reports that are available in the new tool, which aren't as much information. So here's the existing report, which shows us the two plans side by side. It shows us the drug list for the drug list that was entered with those 4 medications. For each of those 4 drugs, it tells us which tier the drugs are in for each of these plans. So you can see, some of them have different tiering for different medications. It shows us, again, the premium. If there's a deductible, it shows us that. It shows us the total number for the year. This is, again, that most important number is really that total cost, which is the premium plus the cost of the drugs, which includes the deductible. If they hit the donut hole, if they hit it's all factored in there for us. That's the most important number in this whole tool to help us figure out what's most cost effective. And that number is in this report. So you can see with the WellCare plan for 12 months, the premium plus the deductible plus the drugs, everything all in is projected to be $920. The Cigna plan all in for 12 months is projected to be $932. That's the premium, again, plus the cost of the drugs. Enrollment today basically just shows us, based upon if they enroll in August, as of September 1st through the next 4 months, September, October, November, December, through the end of the year, what the total cost would be, premium plus the cost of the drugs. That's that number we saw on that first plan results page. So that's also good information here. It breaks the cost down by each of the drugs for each of the cycles of the Part D, the deductible, the initial coverage, the coverage gap, catastrophic coverage, and I have other videos out there that explain what all these different phases are. That's not the purpose of this video, but the detail is there. That's the point. The information in the existing report is really phenomenal. It gives you a month-by-month breakdown and charts. It tells you when you're going to meet the deductible, if you meet the coverage gap. All of that is in this report, which we can send out, and we do send out to our clients, so they have a visual document that explains all this. We walk through any questions they have. So it's all there. The information is really great in that existing report. In the new tool, I'll just show you. We're going to do an add to compare, and we'll compare the same 2 plans. Which again, I wouldn't know that the Cigna plan would be, just happen to be 3rd in the list of premiums, but I wouldn't know that that's one of the more cost-effective plans for this individual. But we hit compare for those 2 plans. It gives us a side-by-side with some of the same information, premium and deductible. It tells us the 4 drugs are covered. Estimated yearly drug cost. Again, this does not include the premium. So The drug cost is one factor, but we have to manually go in and multiply the premium times the 12 months, add that into the drug list, for each one of these plans to get the total number, which is, again, just not possible in the time frame we have for the volume that we have to get through. It doesn't break down the drugs for us, so it doesn't show us, for each of those drugs, how much they're going to cost on each of these plans. It just gives us that total number. If you hit plan details for one of the plans, actually, you can print a side-by-side comparison, and you'll see the print option here, and I'll hit open PDF so you can see it a little bit clearer, but this is what the new report looks like when you're comparing side by side. So we still have the premium and the deductible showing up. We don't have, again, that total number for the year. What's the total projected number going to be? What's my total budget for drugs? Premium plus my drugs. That's not in this report. It gives us the total drug cost, and it gives us the monthly premium, but it doesn't calculate those together. And again, anyone can multiply that amount times 12 and add in the drug cost, but to do that for 26 different plans for thousands of, or there's millions of Medicare beneficiaries out there that are going to, if they want to figure this out, are going to have to manually do this for all these plans. It's incredibly inefficient. So there's the drug costs. There's nothing in here about each specific drug. Like, again, the existing report that we have with the current tool breaks down each of those 4 medications so we can see what are the main cost drivers. Why are my costs, so high or so low? The one in this case, the Synthroid, is a brand name drug, so it's showing a higher cost. We don't have that information with the new report, so it's going to be very difficult for Medicare beneficiaries to understand what costs are driving, or what drugs are driving their costs. So these are some of the main concerns we have with the new tool. Again, this is only after about a half a day playing around with the tool. Hopefully some of these will be resolved in the next few weeks before the old tool gets unplugged. But as of now, in the current state, without knowing that total cost for the year and being able to sort the list, we cannot guarantee we're going to find the most cost-effective plans. And that's a major problem. Last year, I mentioned earlier, we saved our clients over $2 million on their drug plans alone. That's a huge savings for Medicare beneficiaries, and we're just one agency. So, you multiply that out times there's millions of beneficiaries out there, and if they're properly shopping their drug plans and the savings that are out there, without some of these things being added to this tool, there's going to be a lot of missed savings in this year's annual enrollment. So, sorry for the dire nature of this video, but we wanted to bring these to everyone's attention as soon as possible and highlight some of these concerns. And hopefully, again, some of these things get resolved in the next few weeks. Otherwise, this annual enrollment period is going to be quite a challenge for us. So I hope everyone has a good week, and we'll try to provide updates as we get more information, and some of these things hopefully get updated before annual enrollment. All right. Hope everyone has, like I said, a great week. Take care.